Hi, welcome to Health Street, and our topic today is shock. What is shock? So shock is a medical emergency condition that occurs when body's vital organs and tissues do not receive enough oxygen and nutrients to function properly. So when the body's vital organs are not receiving enough oxygen and nutrients to function properly, that is when we say there's shock. And you well know the vital organs. They include the brain, the heart, the lungs, the liver. So those are the vital organs. When the vital organs are not receiving enough nutrients and oxygen, that is when we say there is shock. And what supplies the vital organs with nutrients and oxygen? Blood. That means when there is shock, there's a problem with the flow of blood and the blood volume. So when the blood volume is low and the blood flow is not there or it's low, that's when you're going to experience shock. So shock is characterized by reduced blood flow or a drop in blood flow and blood pressure. And what causes shock? It can be caused by various underlying health conditions. For instance, an accident where you lose a lot of blood, you end up having shock. So shock, no supply of enough oxygen and nutrient to the vital organs. And how to identify a shock? You will be able to realize there is a drop in pulse, that is the blood flow, and there's a drop in blood pressure. We talked about the vital organs. So that is how to identify a shock. So let's look at the types of shocks, because we have various types of shocks depending on what has caused that particular shock. We have hypovolemic shock. Hypovolemic shock, this type of shock occurs due to a significant loss of blood or other fluid, such as from bleeding, severe dehydration, and burns. So when you lose fluids, body fluids, when you lose body fluids because of bleeding, burning can dehydrate you, or severe dehydration, when you're not taking enough water. Anything that makes your bodily fluids drop significantly is going to give you this type of shock. Then the second type of shock is cardiogenic shock. And this type of shock happens when the heart fails to pump blood effectively. And why would the heart not pump blood effectively? It can be because of heart attack, heart failure, or other cardiac issues. Anything that makes your heart not pump blood effectively will cause you a cardiogenic shock, because for a proper supply of blood to your vital organs, you need your heart pumping. So cardiogenic shock. And then we have another type of shock that is called distributive shock. And this category include various forms of shock where there is a problem with blood vessel tone and distribution of blood. So distributive shock include various forms of shock when there's a problem with blood tone or distribution blood. Distributive, it is self-explanatory. It is anything that is interfering with the distribution of blood, and what distributes blood into your body, that is the blood vessels. So we are going to talk about the types of distributive shock. So under distributive, we have types of shocks there. So we have septic, we have anaphylactic shock, then we have neurogenic shock, and I'm going to touch on each one of them. So septic shock, that is one under distributive shock. This is caused by severe infection that leads to a systematic inflammatory response. You understand? So you have an infection that causes your system to have an inflammation. And if you have inflammation, that means even your blood vessels are going to be affected by this inflammation. And what happens when there is inflammation? So the flow of blood is affected. So that is the first one, septic. And then we have anaphylactic shock. So anaphylactic shock, this is a severe allergic reaction that causes blood vessels to dilate and blood pressure to drop rapidly. An allergic reaction that causes blood vessels to dilate and blood pressure to drop rapidly. This is a reaction because of an allergy. For example, somebody can be stung by bees. There are some people who react to certain allergens. So if you react to an allergen, this might cause your blood vessels to dilate. If you have a pipe that is passing water and then you expand the pipe, the pressure is going to drop. The same thing happens to your blood vessels. So if your blood vessels are dilated, the pressure of blood is going to be low. So, and this low pressure is going to affect the supply of blood into your vital organs, because your vital organs need a significant amount of pressure so that they can get blood, which includes oxygen and nutrients, in time. Okay? So that is the second type of shock, under distributive shock. We are in the third one, under distributive shock. So you have neurogenic shock. So neurogenic shock is typically caused by spinal cord injury or severe brain injury, resulting in a loss of So neurogenic shock is basically if your nervous system is hurt, if your spinal cord is hurt, your spinal cord allows the passage of nerves, and if your spinal cord is hurt, most of the functions of the nervous system are going to be affected. So about neurologic shock, this is caused by an injury to the spinal cord. So when your spinal cord is injured, there's a loss of sympathetic nervous system control over the blood vessels. You know, the sympathetic controls functions like the heart rate. So, and that is where we get the control over the blood vessels. And you might be asking yourself, what is the relationship between the spinal cord and the sympathetic nervous system? Because we know very well, we are going to talk about the nervous system very soon, and you will find out that a sympathetic nervous system is part of the peripheral nervous system, whereas the spinal cord is part of the central nervous system. But they are connected. We have a sympathetic chain or a sympathetic trunk, and this chain runs alongside the spinal cord, containing ganglia or clusters of nerve cell bodies. So when the body perceives a threat or a stressor, the sympathetic nervous system is activated, and signals originating in the brain, they will travel down the spinal cord and synapse with the neurons in the sympathetic chain. So you understand how they are related, yeah? From there, the signals will be transmitted to various organs, organs and tissues throughout the body, and these will bring about the appropriate physiological responses and prepare for action. So you understand the connection between the sympathetic nervous system and the spinal cord. So distributive shock, and under that we have 3 types of shock. We have septic shock, anaphylactic shock, and neurogenic shock. We go to the 4th type of shock, and that is obstructive shock. And what is obstructive shock? Obstructive shock occurs when an obstruction prevents blood flow, such as in cases of pulmonary embolism. So this is a blood clot in the lung. So obstructive shock occurs when there is an obstruction, and this obstruction prevents the blood flow to that particular vital organ. For instance, you can have pulmonary embolism, and that is a blood clot in the lung. So when there's a blood clot in the lung, this is going to obviously block the flow of blood in that particular area where we have the clot. Okay, so that is an obstructive shock. We can also have a cardiac tamponade, where fluid accumulation around the heart, preventing blood flow. Imagine if your heart is surrounded by fluid. And then we have something like tension pneumothorax, a life-threatening lung condition that can obstruct blood flow to the lungs. So anything that is obstructing blood flow to the lungs, to the vital organs, can cause obstructive shock. The next type of shock, which is the 5th one, is the psychogenic shock. And by the way, some people call it neurogenic shock. Apart from now, the dynamics of the neurogenic shock is different, because in neurogenic shock we say it is the injury to the spinal nerve, but the way this type of shocks operates is the same as the way the neurogenic shock operates, because it is not, with this type of shock, it is not that there's a physical cause of blood disruption. Blood flow disruption is an emotional, it is caused by an emotional state of mind. For instance, if you experience intense fear, intense pain, something, you hear some news, so this can cause a temporary drop in blood pressure and heart rate. Unlike other forms of shock, a psychogenic shock is not caused by a significant loss of blood or fluid. Okay, so psychogenic occurs typically in response to a trigger such as extreme emotional distress, fear, pain, or seeing something disturbing. So when a person experiences intense emotions or stress, the autonomic nervous system can overreact, leading to a sudden decrease in blood pressure and heart rate. And this reaction is usually mediated by the vagus nerve, which is part of the parasympathetic nervous system. So with the neurogenic shock, we talked about the sympathetic nerves. So when there's a spinal injury, we talked about the sympathetic nervous system being deactivated or losing its control. Obviously, when the sympathetic nervous system is not at work, what is at work? We have the parasympathetic. The parasympathetic nervous system is about rest and digest. So just know that when the parasympathetic nervous system is at work, we have lower heart rate, we have everything lowers down. It is time to rest and digest. And when we have sympathetic system at work, things are high. We have higher heart rate, we have run and jump, those kind of reactions. So it is hyper and the parasympathetic is lower. So you've understood, yeah? And in this type of shock, the psychogenic shock, they usually a sudden, somebody can become, usually the person becomes unconscious or what we call fainting, but it usually resolves itself. Although you have to observe this person, you know the rules of taking care of an unconscious person. Although it will go away because it's not an actual loss of blood, it's just a situation that is going on at that particular time, but it's going to disappear with time. All right, so you just have to take care of that person as a unconscious person, and then it will go away. Of course, I'm going to give you an acronym on how you manage shock generally. All right, but before that, we can look at the symptoms. How can you identify somebody who is suffering from shock? First of all, if this person has experienced the conditions we have talked about, for example, this person is dehydrated, like that can be the first determining factor. If they are dehydrated, and you can tell, oh, this person has been dehydrated, or they have an allergic reaction, or they have received some news, or they're in extreme pain. So that can be the first indicator. Although now we are talking about I'll give you the signs that you're going to see in this person. So this is just the background information you might have about this person. You might have a background information that they have had a spinal injury, or they have been stung by insects like bees or wasps, or they have been told some news. You can have this background information behind your mind, or they might have told you that. But now there are some things that you can see. First, you will realize that they have a rapid and weak pulse. So this pulse is going on quickly, but it is weak. It's tata. You know how to check the pulse. You can check their radio pulse. You can just look at we have brachial pulse, we have radio pulse, we have carotid pulse, we have all those kind of pulse. Check their pulse and see how their pulse is. If it is rapid and weak, then there is a possibility of shock. Another thing you can check They might have rapid and shallow breathing. Third, so they might have a cool and clammy skin, and this means their skin feels moist. It's cool. It's not warm. Naturally, if you touch your skin, you're going to feel the warmth. So if you touch this person's skin, they are not warm, and it is moist. You can feel that it is moist, unusually moist, and sticky to touch. If you touch it, it's sticky. So cool, clammy skin. And then you have the third one, can be confused, altered mental state. Obviously, if your brain is not supplied by enough blood, you're going to look confused and altered mental state. This person does not remember things. They're just confused, yeah? So there is rapid and decreased urine output. So this is contradicting, I know, yeah? Because we are saying rapid or decreased urine output. Obviously, if your body detects that your blood pressure is low, so rapid urine output usually occurs in the first stages of shock, okay? But as time goes by, you're going to realize there's decreased urine output. So why the rapid urine output comes about is because the hormones. First of all, the body is going to detect that you have low body fluid, and now it's going to activate hormones like adrenaline. And when such hormones are activated, your body will store more water, will send more water to the kidneys, right? That's when you're going to have rapid urine output at first, but then later on it's going to decrease. And then the next symptom that you might realize is weakness or fatigue. This is common sense. If the blood is not supplied properly in your organs, you will not have enough glucose, and glucose is going to give you energy. So no energy, you're going to be weak, and you're going to be feeling fatigue. So the person will just look tired and weak, and if they are talking, they'll tell you about fatigue. You'll also see it, yeah? So there's dizziness or fainting. So dizziness or fainting, that is self-explanatory. This person, as I told you, especially with the psychogenic shock, they might faint. And actually, all types of shock can lead you to fainting, because if your brain is not supplied with enough oxygen, these vital organs, they work together to keep you conscious. So there is a very big likelihood of fainting in shock. All right, so I hope that is clear. So let's look at how do you manage shock quickly. Obviously, these things you're going to talk about them in depth as time goes by, but for now, just know the basic care of shock. In management of shock, we are going to use an acronym PELCRN, PELCRN, and this acronym represents, so P we have position, E we have elevate the legs, L we have loosen the garments, C we have climate, R we have reassure, N we have notify medical personnel. Okay, this acronym can mean different things, but yeah, that is the basic one. So position at the back, so you lay the person on their back, but you also have to, so you lay the person on their back, and then you elevate their legs. Elevating their legs allows the blood flow to stop going to the extremities, and we want the brain to get enough oxygen and nutrients. And because this blood is little, so we are trying to save it to go to the head. That's why you elevate the person's legs. But you also have to consider factors like, if the person has got spinal injuries, then you will not elevate their legs, because now you'll worsen the condition. There's a basic life support and first aid principle that says, do no harm, do not do more harm to the patient, all right? So if you elevate the legs and this person has got other conditions that might be worsened by that, then that is worsening the condition. So you also have to consider, before you do these things, you have to be very considerate of all the situations around. And that is why the first one of the things that that a first aider should have, or a basic life support holder should have, is something we call assessing power. You have to do your assessment properly and quickly, because time is of essence. All right, so we have talked about position at the back, elevate the legs, loosen the garments. So if this person is having tight garments, of course you want the blood to flow properly, so you have to loosen their garments. And then the next thing you have to check is climate. Climate means if it is hot, if it is extremely hot, of course you have to go with the climate, but also realize that the person who is experiencing a shock is cold, is feeling cold. You might be feeling warm, but they are cold, so you have to cover them. We have even seen thermal bags that covers these people, that covers somebody who is undergoing a shock. But again, if it is extremely hot, if it is in a burning desert, then you have to be climate sensitive. But most of the times they are cold, because remember, blood distributes warmth into your body. So you might see somebody shaking because they are feeling cold. All right, so R represents reassure and reassess. So you have to reassure always. You will always be reassuring your patient, telling them it's okay, or telling them what you're doing. Okay, reassure your patients on what is going on. And then N, you have to notify the medical personnel. You have to call for help. You notify the people who will come and assist you in this. We are assuming you're doing a first aid, or you're a BLS holder having a patient experiencing shock. So you have to notify the hospital, you have to notify the ambulance to come and give you more help. All right, so that's about shock. I hope we have covered enough. So we have defined shock. I've given you types of shock, and I've given you a simple way to manage shock, at home as a first aider or a BLS holder. All right, bye guys, see you in the next topic.